been answered. I'd like to invite Eric and Linda to turn on their videos at this point, and we're going to get a little bit about their stories with their urinary diversions and have a little chat dialogue, and then we'll open it up for the questions that you've submitted. So again, if you have any questions, please be sure you put them in the Q&A box at the bottom. So Eric, welcome. It's nice to have you here, and I'm very delighted that you're willing to share your story about your neobladder. So tell us, how did you end up with a neobladder? Give us the short and simple so we have time for everybody to speak, but how did you end up with a neobladder?
Well, first it started with cancer. When I was looking into the different choices, and basically there's three. There's the neobladder, there's the Indiana pouch like Linda has, and then the other urinary diversion to a bag. I was trying to consider what I want to do, and how I don't want to be reminded of cancer. And I felt as though that the neobladder would be more like my regular life. And it has been. That has been a tremendous bonus, from surviving cancer, is not to have this daily, reminder. My life has gone back pretty much to where it was before. The only difference is I'm on a time clock, which is kind of pretty natural. It's every 4 to no more than 5 hours that I have to drain the bladder, and that's on a pretty much 24-hour clock. I still do the nighttime, get up after about 4 hours sleep, drain, and then go back to bed for the rest of the evening. So it was a decision of lifestyle and what kind of maintenance I wanted to have with it. I did look into everything, the possibility of side effects, the possibility of complications, and just weighed them all together and thought that this was the best choice for myself at the time.
So great. Let's hear from Linda first, and tell us, your, Indiana pouches are not, or continent cutaneous pouches are not the most common type of a urinary diversion. How did you get to that place, Linda? You're on mute. Can you just turn your audio back on?
Yeah, it wasn't easy. I got a lot of information when I first talked to Dr. Pohar. Initially, they were thinking that I would have just chemotherapy. That was something inserted in my bladder, but that didn't work out because the cancer had gone into the wall of my bladder. So I read the information. I actually did see about BCAN and tried to find out more about the bladder, and different people were speaking on what their experiences were. And I was fortunate enough to know some people who referred me to two people who one had a neobladder, the other person had an outside bag. So I spoke to them, and they both were pretty satisfied with their procedures. The person with the outside bag had said that she had a bowel blockage. I don't know if that was because of that, I don't know, because I ended up having a bowel blockage too. But I have a niece who's a nurse, and she said, well, Aunt Linda, I don't know, I'm not a stoma nurse, but I have seen different people come in with different, with the bags and things. And she told me about the irritation about the skin around where it's a bag would be attached. And she said she'd seen some really kind of severe reactions from that. And I know I have a friend who has a bag for his bowel movement, and he's had a lot of complications dealing with the skin surrounding that. So I kind of had a little bit of reactions from adhesive. So I guess I talked it over, but her input gave me more inclination with the Indiana pouch, even though it was going to be a longer operation. And I did have a total hysterectomy during the same operation. So I think she was saying that she thought I could handle it. She said, well, some patients couldn't. And then Dr. Pohar reassured me that he thought I was healthy enough, and he wouldn't ever have even given that option if he didn't think I would be able to cope with that catheterization every 4.5 to 5 hours from the stoma, and the care of the stoma to keep it, clean and free of bacteria, things like that. So that's kind of where I came up with my decision, and I'm been very happy with the decision. I did, like I said, I did have a bowel blockage and had to go back to the hospital at one point in time. But in general, I've got used to the schedule. I use my phone to kind of remind me, set an alarm every 4.5 hours. I put it 4.5. So, because sometimes, you're like, oh boy, and you don't just jump up and catheterize. So I give a half-hour kind of time limit that if I'm in bed, I'll kind of like, okay, I'll get out and I'll do my catheterization. So I also, though, have been able to feel kind of full. And in my back, it lets me know that it's approaching 4.5. My body just kind of lets me know it's approaching a time when I need to empty my bladder also.
Well, it sounds like you really weighed the pros and the cons and had some guidance from your niece, who's a nurse, to, help you come up with that decision to make that. So you mentioned that you had a bowel blockage, but let me ask Eric, have you had any complications from your neobladder that you've had to, address in the long term? You've now had your neobladder for 5 years.
Yeah. I'm one of probably the rare ones that never really came up with anything that would be considered a real complication. There's the typical post-operation recovery. You go through sometimes bowel problems, but that was within the first 3 months or so. It just, since that point, really nothing has come up except for one incident which came up that I made Dr. Shuckman aware of. Is I passed blood once more, and this was about a year ago, and made an appointment, brought in a sample. We did another cystoscopy just to make sure everything was okay, and it was, and it has never taken place since. And really, I don't think we came up with, Dr. Shuckman, any real cause that we could find. So it was just a rare occurrence. But other than that, nothing really has come up along the way. And like Linda, when this neobladder gets full, you really don't need as much your watch as you actually do as the years go on in recovery, or at least in my case. You actually get that feeling of pressure, like your old bladder, kind of like, hey, I'm full. It's time to take care of this. It was advertised as being just, a piece of your intestine, and it has no nerve endings to talk back to you. But evidently, as it fills up, it starts pushing against everything else, and it all starts getting irritated, kind of like, yeah, you're taking up my elbow room. And then maybe you should check your clock, check your time. So it's,
okay.
Like I said, it's like going back to
it's definitely, you're living
life.
by the clock, right? You're living by the clock.
Yeah, I do adhere to the clock, but if ever, you get involved in work or something, sometimes that will be an indicator that maybe I ought to check. Oh yeah, hey, maybe it is time.
Yeah, and maybe I could speak to that just a little bit, Stephanie. I mean, I think one of the what I would call like underrated long-term issues with any urinary diversion, and I'd be interested what Dr. Pohar has to say, is that is the issue of sleep, honestly. And we didn't address that at all in this conversation. So with a neobladder, we're always telling people to get up and void in the middle of the night, or with an Indiana pouch. Normally we're asking people to get up and catheterize one time in the middle of the night. Even with a conduit, patients have the most ingenious things that they come up with to be able to put their urine bag in the right place, by the bed. And I have patients who have rigged up, like wall suction units in their house so that the bag stays empty. But I do think thinking about sleep is a huge thing that patients could consider prior to surgery. Kind of what are you willing to be doing long term in the middle of the night? And I talk a lot about that, particularly with patients who are having an Indiana pouch, because I tell them you have to get up and catheterize once. And I know really long term, some people don't because the pouches get kind of big, but in the short term, for sure, and that lack of sleep can be a pretty serious factor for some patients.